Hello, I'm Amon. Today we're diving into a topic that affects millions of lives every year, yet often goes unnoticed until it's too late. Today we're talking about sudden cardiac arrest, a medical emergency that can be fatal within minutes. It strikes without warning, turning ordinary moments into life or death situations. Sudden cardiac arrest, or SCA, happens when the heart's electrical system malfunctions, causing it to stop beating unexpectedly. This is different from a heart attack, which is caused by blocked blood flow. It's a leading cause of death worldwide, yet many people don't know what it is or how to respond. Quick action can make the difference between life and death. Here are 7 critical facts about sudden cardiac arrest you need to know, so you can be prepared to help save a life if the unthinkable happens. Sudden cardiac arrest and heart attack are often confused, but they are actually very different medical emergencies. Understanding this distinction can make all the difference in how you respond and in whether someone survives. A heart attack is caused by a blockage in the arteries, a plumbing issue that restricts blood flow to the heart muscle. In contrast, sudden cardiac arrest is an electrical malfunction that causes the heart to stop beating altogether, often without warning. During a heart attack, the person is usually awake and may complain of chest pain or discomfort. But with sudden cardiac arrest, the person collapses abruptly, becomes unresponsive, and stops breathing normally within seconds. The response is different too. Heart attack victims need urgent medical attention at a hospital, but someone in cardiac arrest needs immediate CPR and a defibrillator on the spot to restore their heartbeat and keep oxygen flowing to the brain. While a heart attack can sometimes lead to cardiac arrest if not treated quickly, they are not the same event. Recognizing the signs early can prevent one from turning into the other. Knowing the difference between a heart attack and sudden cardiac arrest and how to respond can truly save lives. Your quick action could mean the difference between life and death. SCA doesn't just strike the elderly or those with heart disease. It can happen to anyone, anywhere, at any time. Even young, healthy athletes and children can be affected, often without warning. That's why everyone should be prepared to act. The first person on the scene is usually a bystander, possibly you. When sudden cardiac arrest, or SCA, strikes, every single second truly matters. Survival rates drop by about 10% with each minute that passes without help. Time is the most critical factor, and delays can be deadly. Brain damage can begin in as little as 4 minutes after the heart stops, and if 10 minutes go by without intervention, the chances of survival become extremely slim. That's why immediate response is so important. Taking action right away is vital. Call emergency services, start chest compressions immediately, and use an AED if one is available. These steps can double or even triple a person's chance of survival. Recognize the warning signs: sudden collapse, unresponsiveness, and abnormal or no breathing. Acting quickly when you see these symptoms can save a life. Don't wait for professionals to arrive. Your immediate actions are the crucial link that bridges the gap until help gets there. Hesitation can be fatal. Act fast, trust yourself, and remember that doing something is always better than doing nothing. CPR is a life-saving skill anyone can learn. Chest compressions keep blood flowing to the brain until help arrives. Immediate bystander CPR can double or triple survival chances. Hands-only CPR is simple. Push hard and fast in the center of the chest to the beat of "Stayin' Alive." Don't worry about doing it perfectly. Doing something is always better than nothing. AEDs are user-friendly devices that deliver a shock to reset the heart's rhythm. They guide you step by step with voice prompts. No medical training needed. AEDs only shock if necessary, so you can't make a mistake. Early CPR and defibrillation are the best chance for survival. Know where AEDs are in your community. They save lives. SCA often strikes without warning. Most victims have no symptoms beforehand. Sometimes there are subtle signs like fainting or palpitations, but these are easy to miss. Don't wait for warning signs. Be ready to act if someone collapses and stops breathing. The collapse itself is the emergency. While SCA can't always be predicted, you can lower your risk. Maintain a heart-healthy lifestyle. Eat well, exercise, avoid smoking, and manage conditions like high blood pressure. Regular checkups and knowing your family history are key. Prevention starts with being informed and proactive. Immediate CPR and AED use save lives, and bystanders make the difference. Share this knowledge with others. The more people who know, the safer we all are. Take a CPR and AED class through organizations like the American Heart Association or Red Cross. Your willingness to act can save a life. Stay informed, stay prepared. Thank you for watching.